As a senior ophthalmologist, I see a lot of second opinions. Among them, most frequently, is multifocal induced glare. Patients are intolerant of these lenses, and even though it's a small number, they cannot drive at night nor function normally. The best solution is just a lens exchange. By carefully evaluating these eyes and injecting viscoelastic, here using a Donnenfeld to elevate the edge of the capsule and carefully viscodissecting, you can see the wave of viscoelastic behind the lens, which shows that it's freeing up nicely. Going around 360 degrees and carefully injecting viscoelastic allows us to fully disengage the implant from the capsular bag. Here we verify that using the endoscope. We can go around 360 degrees, be sure that we've laced all adhesions to the implant before, just using a simple cut and remove technique. Once the lens is out, we fully inflate the capsular bag again to make sure that we can place a capsular tension ring, which we routinely use with the crystal lens. Here, just flexing a little bit to get it started, be sure that it engages at the very sulcus of the capsular bag. A little hook up here with the capsular, anterior capsular rhexis is easily dealt with, and injecting the crystal lens is pretty straightforward here. The crystal lens seems to be the only monofocal lens that gives us some accommodation, and we use this routinely in exchanges. As combined with LASIK, we get superior visions and correct a lot of the aberrations, which can also contribute to this problem. Getting the lens well centered, fully into the sulcus, removing viscoelastic, making sure it stays posteriorly, and being sure to have a totally watertight incision is critical to making sure these lenses do not move or Z later on. By doing both edges of the incision and carefully doing the posterior surface of the anterior leaflet of the incision and in hydrating the stroma, we can assure that we have a watertight incision. This is tested using the Seeps betadine test, and you can see there's just a little tiny stream of aqueous coming out. And we also add some alpha-GAN, as these patients can spike pressures.